Okay, so we've centered our collimation on our plate, the same as what we've done before. We've got our patient roughly in the right position. So for this one is a craniocaudal view of our elbow. Now at the moment the head's in the way here, and as you can see the elbow kind of rolls laterally here. So we want this to be much more medial so it sits nice and straight. So what we're going to do is we're going to prop the opposite leg up here. And sometimes you might need one sort of foam wedge for this, you might need two. And sometimes you will find as well that the animal starts to kind of slip away from you at that point. So placing a foam wedge just at the chest opposite can help as well with a sandbag behind it. We're now going to move this head out of the way. Place a sandbag over top here like that. Careful at this point, because we are kind of bending the head right round here, is to make sure that we're not obstructing their airway. But at the same point, even if they are intubated, some ET tubes can bend and occlude when you bend their head round too much. So you really want to be careful with this one, that you're not affecting their airway by moving the head around too much. Another thing to look for as well is that this sandbag here obviously will show on your image. So if you let this kind of roll down, sometimes that can superimpose over your elbow. Okay, so now we've got the patient roughly in the right place. We can pull this limb forward, and you can see there that already that's sitting nice and straight. So on this one, we're looking to kind of center point around these kind of humeral condyles. So we're a little bit off, but not too far. So we just need to pull this patient back slightly. It's really important with this one that we start with the patient roughly in the right place, because there's so many aids that we're using here that what we don't want is to have to move the patient excessively. Okay, so at this point you might find sometimes that there can be a big gap kind of here, and maybe that needs a little bit more support. You can place a little extra kind of foam wedge in here if the patient needs it. Sometimes you might find as well that some arthritic patients, even under a fairly deep sedation, will start to try and pull their limb backwards. So sometimes supporting it with a foam wedge can be helpful as well. So what we're going to do at this point is I'm going to place my hands around the elbow, so onto the olecranon now, and I really want that to be straight down on my plate in order to keep the elbow as straight as possible. And I should have a nice straight line from my shoulder here all the way down through my elbow all the way to the carpus. So that should be one nice straight line. So once I've got this, I can now be thinking about my collimation. So humeral condyle, center point, then we're going to go a third of the bone in either direction, so same as what we've talked about before, and then we're going to go to the skin edges either side. And what can be helpful as well is to make sure that you do have this centered properly. You should have the same amount of light either side of our elbow there. So you can see there how we've got a little bit more light one side. So I just need to move my elbow over slightly to make sure that it's nice and straight. I can now place my marker in place. So this is the animal's right limb. Place my right marker. Now, as with all our limbs, they are less than 10 centimeters, so I don't need a grid. And now I can go ahead and take my image.